Very good afternoon and welcome to our weekly media briefing and public health update with Montgomery County Executive Mark Ulrich. I'm Lorna Virgili, Hispanic Public Information Officer, and joining us today is Dr. James Bridgers, Director of the Department of Health and Human Services, as well as Dr. Nina Ashford, who is the Chief of Public Health Services for HHS. Mr. Sean O'Donnell, Acting Deputy Chief of Public Health Services, and today we have two very special guests. Anita Basalo, who is the Director of the Montgomery County Public Libraries, as well as Karen Chris, who is a supervisory therapist, also for HHS, under the Child and Adolescent Behavioral Health Services Program. Good afternoon, everyone. Mr. County Executive, good afternoon to you.
Good afternoon to everybody. Thanks for joining us. I just want to begin by saying how saddened I was to learn last night about a massive earthquake that hit Taiwan. We know it has taken lives and injured many people. Experts are calling it the strongest to hit the country in 25 years. I remember when I was over there, we did a tour of their emergency center. One of the things that struck me was they kind of showed us all the things that happen there regularly: cyclones, earthquakes, all the usual stuff. And I asked them, how often do one of these major events occur? And they said about 50 times a year. And I was just kind of stunned because, that's a lot of major events to be dealing with in a year. I was in communication last night with a number of people that we'd met over there, and people seem to by and large be safe. Their buildings in Taipei were not as severely damaged as the buildings closer to the epicenter of the earthquake. So everybody seems to be okay, and most of their operations are more or less normal. You have to remember that I mentioned their emergency response network because it really did impress me. And it was clear that, they had the capacity to really save lives because they had robust communications across everybody who's involved in public safety. And so they were able to act very quickly and in a very coordinated way. And I think that has a lot to do with their management of a crisis like this. This morning in downtown Silver Spring, we talked public safety. And during my administration, I've prioritized listening to the public and using that feedback to help shape our way forward. I've heard from the public, businesses, and residents alike about the level of crime in the community. And we wanted to talk about how we've been responding. It's clear that a lot of people aren't aware of some of the significant programs we've put in place. I was thinking about it before I spoke. If we put a program in place, it's not going on neighbors and being alerted to everybody in the community. But when an incident happens, people get rapidly notified of the incident on social media. And so I think all of us felt we wanted to take the opportunity to point out what we are doing and some of the significant programs we put in place. And we, meaning myself, the council, and the police department, really wanted this opportunity to elaborate on those efforts. Part of what makes people feel less safe is the severity of some of these crimes and how reports of these incidents, real or exaggerated, are spread on social media. And when I went on an MCPD officers ride-along earlier this year, I noticed that many times they don't have time to do the kind of community policing we would prefer to happen in Montgomery County, and it's all driven by staff. We are short-staffed, and it was clear in my ride-along, our officers are basically going from call to call and not able to proactively patrol an area. Today was an update on what we've done and what we're going to have to continue to do to drive down the crime rate across the county. And I want to thank all the law enforcement that serve in Montgomery County for their role in public safety. I also want to thank the businesses that continue working with our police to help keep our community safe. And I want to thank those folks in HHS who help provide emergency responses for people, but that aren't police responses, who take some of the load off the police by responding to people who are having mental health crises with resources more appropriate than sending the police for all the incidents. We're creating the infrastructure we need not only to solve crimes, but to prevent them. And what we are trying to send is a very clear message We are serious about what we're doing between our drones and our cameras and the work we're doing. We're going to do everything we can to make people safe and to make it more difficult for people to do things that are unwanted. And we don't want people to think this is an easy place to come to. We'd like to get a reputation for being a difficult place to come to if you're thinking about committing a crime. I addressed many of our tactics this morning, and we'll have details in my newsletter this week, which gets published every Friday. And it can also be found online at Montgomery County MD, Montgomery COMD at blogspot.com. The other day, I toured the Manna Food Center in Gaithersburg to highlight Food Waste Prevention Week. And Manna helps turn millions of local dollars into food for our community, working with our partners to ensure free food reaches families in need. The county's Edible Food Recovery Working Group is looking into ways to increase edible food donations. Still consumable food like prepared meals, baked goods, fresh produce, and canned or boxed food can be saved from disposal and donated to food rescue organizations instead. This kind of synergy makes a lot of sense. The county's zero waste goals of achieving zero waste could benefit from redirecting the extra food to security partners. Right now, anything in the trash is getting burned, and it's a shame to be burning food that could actually be useful in the community. And I just want to highlight that food insecurity is a real thing. Before the pandemic, the county was not putting a lot of money into food, and I know a lot of people felt we didn't accurately estimate the degree of need that there was. During the pandemic, the county was putting in upwards of $17 million a year. Because our service providers indicated last year that the need had not gone down, that the lines were as long as ever, we put in 17 million last year, and we put 17 million more in the budget this year to help people deal with food insecurity. As part of Earth Month this April, we're asking everyone to take an active role in improving our environment by following the suggestion to act now. I hope this program will inspire every resident and business owner to seek out ways to adopt sustainable practices. Meal planning, altering preparation techniques, and composting can all help minimize the trash created from cooking. And we'll be talking to you all a lot more about the future of composting in Montgomery County over the next few months. This week, we also recognize National Public Health Week. And ever since the beginning of the pandemic, I think we have renewed respect for the work of our public health staff. And this week, we wanted to highlight their work. During the pandemic, when many of us could stay home in our homes and work, they were out in the community doing their jobs, even before we knew whether to wear masks. And frankly, long before we knew where we were going to get the masks from. Many of you who remember the early days of COVID remember that we were using makeshift masks that weren't really up to the level they needed to be, but they were the only masks we were able to find. With whatever masks we had and whatever safety tools we could give our public health workers, they went out and they did their jobs, and they've proven how just indispensable to the well-being of our community they are. And this is a moment to thank them for all they do. This year's theme is protecting, connecting, and thriving. We are all about public health. It's a reminder that public health is about physical and mental health. It's about a clean environment. It's about being connected and having supportive communities. This week, we're focused on mental health of teenagers as we launch Care, Be Aware, Teen Mental Health Week this Saturday, April 6th. The initiative brings together libraries, recreation, health and human services, and the innovation team to offer events across the county aimed at helping teens. Mental health plays a crucial role in enhancing the lives and well-being of their youth in the county, and for far too long, there's been a stigma about mental health. Although that stigma has thankfully eased, we are still aware that all too often mental health concerns are overlooked or ignored. And when not addressed in children and young adults, it can become much worse as they get older. We're calling this effort Care, Be Aware, to spotlight the resources available in our community for our young people and their families. Some events include a poetry slam with rap artist Queen Sheba, rec zone events at county schools and rec centers, and workshops on art and writing. The idea is to introduce fun and engaging ways for teens and adolescents to relieve anxiety and learn about partners in community that can help with mental health issues. Care Be Aware will coincide with the Respect Fest, an annual anti-bullying effort for teens on Sunday, April 7th at the Wheaton Recreation and Library Center. A priority that I've set for my administration since day one is to break down silos between departments and utilize all the resources we have to assist in common goals. An effort like this that is uniting the resources of our HHS and Recreation Department along with our libraries and being assisted by our county innovation team is exactly what I wanted to see, and I expect to see more of this in the future. I'm now going to turn it over to Karen Christ, who is supervisory therapist at HHS's Behavioral Health and Crisis Services, who specializes in children and adolescents, to talk about the importance of mental health among our teenagers, as well as the Department of Public Libraries Director, Anita Vassallo, who is hosting and promoting this outreach effort in our libraries. So I'm going to stop for Karen and Anita and turn it over to you.
Thank you for this opportunity to speak and discuss this important topic that, as a parent and a mental health professional, is close to my heart. I work in the Montgomery County Child and Adolescent Behavioral Health Clinic, which provides safety net services for youth who experience barriers to accessing mental health services, often due to financial insecurity, lack of insurance. Sorry, was there? Lack of insurance or transportation, many of whom have experienced complex trauma. These youth have been disproportionately impacted by the pandemic. And we have worked to prioritize referrals on our wait list to ensure that those with the most need are seen sooner, and that we receive referrals from the hospitals, Montgomery County Crisis Center, schools, and community members. We have a bilingual staff. We have a large Spanish-speaking population that we serve as well. As many of you know, the U.S. Surgeon General issued a national state of emergency in child and adolescent mental health in 2021 and reported high numbers of students struggling with persistent feelings of sadness. A large number of the female students reported higher levels also of feelings of sadness and hopelessness, and 25% had made a suicide plan in 2021. In addition, adolescents reported to experience high levels of anxiety in the past 2 weeks and symptoms of depression. We found that female students and LGBTQ+ students were more likely than their counterparts to report experiencing anxiety or depression as well. We've seen an increase in deaths due to drug overdose, double over from 2018 to 2022, and the number of deaths from drug overdose that have increased among Black and Hispanic youth. Suicide is the second leading cause of death among adolescents. These deaths have peaked but have declined in recent years. And in addition to reporting adverse experiences like emotional and physical abuse in home, students also reported bullying. About 34% reported bullying and neighborhood violence. We've seen an increase in school absenteeism as well, and self-harm and suicidal ideation in the clinic, which I think is mirrored also to what's happening on the national level. In 2023, the Surgeon General issued an advisory on our epidemic of loneliness and isolation, highlighting the need for individuals and communities to focus on repairing social connection. And so we found that youth experiencing financial and housing instability, emotional and physical abuse, trauma, and loss during the pandemic went from virtual environments behind screens to large, often crowded schools and classrooms. They had to navigate social skills, conflict, and manage high levels of anxiety without having mastered key development skills such as self-regulation. And oftentimes we're having stress responses to the stimulating environment, making it difficult for them to learn or problem solve, resolve conflicts. In the clinic, we realized we needed to shift our service delivery from providing mostly individual and family-focused services to finding ways to serve more youth and provide opportunities to help youth bridge those gaps and connect while learning and practicing coping skills in smaller settings, so they'll feel more confident in larger group settings, building that transition towards being in back in feeling more comfortable and confident in the school setting. We began providing groups in the clinic, focusing on coping skills geared towards helping youth manage stress and communicate more effectively with others. It's been so powerful to see firsthand these youth who come in shaking to the room with their peers and see how they are able to support and help each other. And we have really focused on cultivating their ambassadorship as youth ambassadors in mental health, and as other programs in the county have been doing as well with the Be the One project. In addition, we collaborated with the school to provide school-based groups and developed partnerships with schools, both in informal and formal situations, to meet the need of the community and continue to help build those bridges. I think the cases where we have had the most success are where the therapist has been able to team with a school member, a family member, to really work together to provide a safety net around that student to help them feel more connected and confident in going out into the school. So we continue to urge families and communities to be creative about creating small pockets of small groups where youth and families can gather, centered around activities or cultural identities such as LGBTQ, or to help them build skills for navigating social situations and make connections with other youth so they feel less isolated. And I think the MCPL, the Montgomery County Public Library's example this week of the Teen Mental Health Week is a perfect example of that. The good news is that we're talking about the mental health in a way that we didn't several years ago, and through talking about it, we can come together as a community to find more creative strategies to help repair and connect youth to families and communities. Thank you.
Thank you, Ms. Chris. Dr. Vasallo, do you have any remarks? Director Vasallo.
But not doctor. I know, I'm in good company here. So the Care to Be Aware Teen Mental Health Week partnership between MCPL, REC, HHS, the school system, and the innovation team really began to be percolating for us about 9 months ago, last August. So we have worked on this for a long time in order to be able to present a great slate of events for teens and their parents during this week. And I would be remiss if I didn't let you all know that the financial support for this week is coming from the Friends of the Library Montgomery County Incorporated, because there are costs associated with this that they're picking up for us. So the kickoff, of course, which is this Saturday with Queen Sheba, will be a wonderful event taking place at the Wheaton Library and Community Recreation Center. But in addition, there will be a teen mental health resource fair there for parents and teens, where they can find information about mental health resources throughout the county. There will also be a workshop with Queen Sheba, and then an open mic session with a poet, Simply Sherry. Queen Sheba is also going to be visiting Wheaton High School on April 5th to speak to the students there about the importance of mental health and her resilience growing up in foster care and how that led her to her career in the arts. The libraries sees many, many teenagers in our buildings every single day of the week. Some of them need more assistance from us than others. They all know that libraries are a safe and welcoming space. We don't ask anyone to register to be in our buildings. We don't ask you to register for our programs. This is available to all residents of Montgomery County and other interested parties. Some other events that we will be hosting during this week, because it's not just our kickoff, are things like a creative journaling several journaling events, and these are at different libraries throughout the library system. A program called Writing Your Script for a Healthy Relationship, mindfulness for teens, some fun things too. An event called Pause to Play that'll take place at the Davis Library with a variety of just fun things to do. Make a zine and ID 7 ways to stay calm at the Long Branch Library. Yoga for teens at the Damascus Library. In addition, the events that will take place at the schools and at the recreation centers. All of this information is available on the library system's website. There is a spotlight prominently displayed. Click on that, and all of the information about this very important week will be available to you there. The other thing that I'd like to remind everyone is that mental health is something that needs to be focused on throughout the year. So we have a lot of support type of programs for teenagers. Service to teens and youth is one of the strategic goals of the library system. We are providing trained library staff at each of the libraries to interact with this age group. And things like Care to Be Aware, our Teen Mental Health Week, is one of the examples of the commitment that the library system has to this very vulnerable and important population of the county. Thank you.
Thank you, Director Vassallo. Members of the media, if you have any questions regarding teen mental health right now, this is the time to raise your hand and ask questions, if you have any. Any questions regarding this topic? Well, Director Vassallo, Ms. Christ, you could remain on the call or drop off if you need to go. Thank you for joining us this afternoon, Mr. County Executive.
Yep. Thank you both for being here. We talk a little bit about our health update this week. As you can see on the graphic that we're going to be posting, we're about to head into peak of tree pollen season. It's interesting to note this pollen season has arrived earlier than usual since we had a warmer winter. Our region just finished its 6th warmest winter to date. Yet another sign we need to act now and combat climate change. And the pollen is here. I'm already noticing it, so I know other people are too. There are simple signs that a person can take to reduce their allergy symptoms. Keep your windows closed when pollen counts are high. Use special HEPA filters and central air conditioning vents that might filter out pollen from the air system. Change your clothes each time after coming inside from the outdoors to limit pollen exposure. Take a bath or shower each night before going to bed to rid the skin and hair of pollen buildup, and wash bedding in hot soapy water at least once per week. Just basic, simple things to do to reduce your exposure to pollen. Despite dealing with pollen, this is also one of my favorite times of year when we start planting gardens and growing our own healthy fruits and vegetables. I love gardening myself. It's one of my favorite hobbies. And not only is it relaxing and interesting, but it produces incredibly tasting food. That means a lot. And I'll say that one of the things I do around my house on Sundays when I'm at full garden season, I specialize in creating a 5 to 7 pepper omelet, depending how many of my peppers are ripe at a given week. And it is rather spicy and rather tasty, and it's a lot of fun to do. And I can augment it with basil and oregano that I pick from my garden. Although not everyone in the county can have access to land to plant the formal garden, I highly encourage use of kitchen and balcony gardens, as well as the use of community gardens. And I'll say again, the bulk of my garden is actually on my front deck. And last year I was able to get in like 10 tomato plants, about a dozen peppers, lettuce, all the herbs I wanted. So you can get a lot out of a small space if you're creative. So before I take questions, I'm going to turn this over to my health team if they want to add anything else, and then we'll be back to the media.
No addition this time.
Nothing for me, Mr. County Executive.
Nothing for me either.
And nothing from you, Mr. O'Donnell? I see Dr. Stoddard has joined this media briefing as well. Anything from you?
I've been here, but I have nothing additional, so we can take questions.
Okay, thank you very much. Members of the media, any questions for the county executive and other officials at this time? Any questions? Going once, going twice? I guess we don't have any questions today. Thank you, everybody, for joining us. Stay safe this afternoon, and I will see you next time. Have a great afternoon.